we're going to use the skin booster. It's a UK brand by the name of Lumipro. It comes in a 2 ml pre-filled syringe. So the boosters are a bit different from the fillers. They are not cross-linked hyaluronic acid. It's slightly less viscous than the fillers, something like the consistency of honey. So this is the 2 ml syringe. So it is 1 ml on each side of the face. And we are today going to do the grid technique of skin booster. There are 2 techniques basically, the grid technique and the BAP technique. So both the techniques are basically used for skin boosters depending upon the type of the skin and the age of the patient. So today my patient is a young patient. She has very good hydration of the skin and a little bit of slight sagging. So we have put a numbing cream on her face to numb the skin. So once we clean the numbing cream, right, we're going to put the markings. So this is this pre-filled syringe with the skin booster. So we remove. So there are 2 needles that you get it with this pack. So you remove this, you fix this needle, and there's 1 needle for each half of the face, right? So this is the needle. So once you fix it, you can just test to see how much comes out, so that you're able to manage the pressure and how much you inject. So if you can see, these are the units here. So for every micro bolus, you're going to inject 0.05 units. That means half of this line for each unit. And so this line in between is a darker line, so it shows you that this much you have to use on one part of the face and this one on the other. So we'll avoid giving it too near the eye. So this is how we mark the face. So the grids are marked so that the injections are around 1.5 to 2 centimeter apart. They're given as micro bolus. So in each quadrant, we're going to inject 0.05 units. So she wants a little bit on the forehead. We'll mark the forehead later. We'll first start on this area. Hope you're comfortable. Mm-hmm. Yeah? Okay. So we'll not go too deep. So these are very safe injections. There is no danger of any vascular occlusion since we are not going to go very deep. So you can see the patient is comfortable. Here we go. Is it okay?
Yeah, a little bit.
Little tingling?
Yeah.
Yeah, okay, thank you. I'll try not to cause too much of pain. So you can basically see the needle through the skin, right? So that means you're in the right space. always try to aspirate so that you're doubly sure that you're not in the artery or the vein. Perfect. So you can see roughly from the corner of the nose to the tragus, you can draw a line. I want little bit lips also, so I'll give 2 injections. Okay. So inject, aspirate, fantastic. So you can see this clear fluid. That means you're in the right angle. So when you're near the eye, it's always better to point your needle away from the eye. Avoid pointing like this. It's always safer to point it downwards. It will be slightly painful here. Very little. Yeah. So the face is done.
Give a little bit on the neck. So you can see there's no bruising. So once it's done, just massage lightly, right? Just massage lightly to spread the booster evenly. As you can see, there's no bruising, no swelling, this light redness which will subside in another 15 to 20 minutes. So basically this is a very safe procedure and it doesn't require any downtime. So she can go back to work or she can do her normal activities immediately after the treatment. So Martina, are you feeling any pain on this side? No.
So you see we have avoided going very near the eye. So this is the area that you should be avoiding. It has excellent results in the cheek and the mid-face area.